Witnesses and doctors have been at odds ever since blood transfusions became common in the 1950s. Witnesses asked for alternative treatments. The medical establishment refused, often forcing blood on Jehovah's Witnesses against their will. Witnesses felt they had a right to determine their own medical care. Doctors felt a religion had no right to let its members die.
Heart rate's been running at 140.
Following the witness way of life isn't easy. At 23, Seth's own faith is being tested.
Do you have any more Prograf, Mom?
A rare genetic disease has been attacking Seth's liver since he was a teenager. Jehovah's Witnesses accept most medical treatment. Seth takes 30 pills a day and gets nightly injections to keep his liver functioning. However, he'll need a liver transplant, and this is a problem. Seth wants the transplant, but as a Jehovah's Witness, he won't take a blood transfusion, even his own stored in advance. To witnesses, blood is sacred. Their interpretation of the Bible tells them to abstain from blood. They say Jehovah used the blood of Jesus to save mankind. Blood represents life and should be left alone.
He is under a lot of peer pressure. You know, this is what you're told. This is what you believe. It isn't, you know, do you want to believe it or not? This is the way it is.
When my kids were little, my sisters would say, well, what if they needed blood? Would you just let him bleed to death? And you know, it gives you pause and you say, well, I hope I never have to face that decision. And here we are. He could compromise and say, I need a liver and I'm going to take blood. This would be his choice. I mean, he's still our son. We'd still love him. You don't ever quit loving your children. You know, and he has taken a stand and he's not going to.
USC will perform Seth's surgery to meet the religious needs of Jehovah's Witnesses. In turn, the hospital gets to test out new technology on them. The aim is to limit blood loss to the point where most transfusions are unnecessary. USC thinks bloodless surgery should be the new standard for everyone. The threat of HIV and other viruses in the blood supply has given doctors an incentive to work with witness patients.
That led to this weird alliance between very strange bedfellows. Jehovah's Witnesses, who never liked blood, didn't want to use blood, and a scientific community trying to figure out how are we going to do surgery if we can't use the blood supply because it might be infected. So they came together in this bizarre confluence and said, let's try and use less blood or no blood.
This is a scary time, but hopefully, more than likely, it's all going to turn out okay. And even if we do lose one of them or both of them, you remember that there is a hope for the resurrection. If he does not wake up, we'll still be able to see him in paradise, the way we were meant to live.
The blood does not leave the body because stay in continuity. And that's acceptable to Jehovah's Witness patients.
This is good research. Of course, ultimately, we're not talking about cells in a petri dish or a lab rat. We're talking about a young man with a family with potentially a long future ahead of him.